And we told you earlier that as COVID-19 cases continues to rise, the National Association of Resident Doctors have now resumed the strike. It suspended in April. And joining us now to discuss this is the President, the National Association of Resident Doctors, Dr. Uyilawa. Okhuaihesuyi. Thank you for joining us.
Thank you for having me here.
So people were hopeful, Nigerians were hopeful that somehow this issue with the National Association of Resident Doctors and the federal government will be resolved, so that we know that the health sector is sort of on track, if not fully on track. But it seems that that's the hope of Nigerians have been dashed today. So talk to us about your memorandum of action, what has been done and what has not been done.
Thank you very much. I'm Dr. Uyilawa, Okhuaihesuyi, President of Nigerian Association of Resident Doctors. We had an MOU signed on the 31st of March, and also on the 9th, and an addendum on the 9th of March pertaining to the problems we are facing in the health sector and respect residents. You will recall that prior to now, we have told you that 19 members we lost to COVID-19, and death and services insurance was supposed to be given to the next of kin. But as it stands, apart from one person that his name is there, the other 18 people have not been insured. Talk more of the other health workers there present. So that have not been done. On the abolishment of the bench fee, which we felt we had 100% impasse, as it stands, the chief medical director of Lutz University Teaching Hospital, Chris Body, has been a clog in our way. He has constantly brought out ways of sabotaging the federal government in trying to bring back the abolished bench fee. As it stands, he has renamed the bench fee as a training fee. He has put into make members to go and pay for indemnity and do tests where they are made to pay plenty of money without any recall. After paying that, now he has made the CMAC to start cutting the block and stop them from training. As it stands, the members on GiveMix, which is a non-regular platform for payment, have still not been enrolled into the IPACE. This is due to a circular that came out from the head of service and that stopped all members from being enrolled into IPACE. Most members in the GiveMix platform are owed between 3 to 6 months salaries as we speak. As we speak, about 114 house officers are still not paid. They're having problems with being enrolled or into their portal. Those in the tertiary institutions are not being given space for house officers to come and do their internship. As it stands, we're also aware that the Abia State government are owing about 19 months salaries to their members. Imo states are owing 8 months. Ondo State is owing 4 months. While Ekiti State is still owed 2 months now. So if you agree with me, you know that nothing has been done about that. Prior to this time, we've also said that their resident doctors and all health workers are being paid 5,000 naira as others allowance. When you know that members in the upper chambers are being paid 1.2 million naira as hardship allowance, 1.2 million naira as newspaper allowance. So that brings to bear where we lay our priorities to. Do you want us to be paid 5,000 naira for putting our lives at risk when we have lost 19 members to COVID-19, more to Lassa fever and other infectious diseases? What is the budgetary allocations for Nigeria sex sector?
And Dr. Okhuaihesuyi, sorry, I have to quickly jump in because you're laying out all of these issues, and I'm sure Nigerians are listening and wondering, why is it that all of these are not being resolved over and over again? I mean, this issue has been on since April. One would have thought that to an extent, because you sound like nothing has been done at all, and one would have thought that to an extent something would have been done. Have you heard anything from the federal government as to why none of these, like you just said, have been resolved?
I've had a series of meetings with the federal government. The last one we held was 2 weeks Thursday ago. We had the instance of the Minister of Labour, Chris Ngige, and the Minister of Health, Dr. Okhuaihesuyi, the permanent secretaries, those members from the budget office, members from the IPACE office. What baffled us there at the meeting was that it sounded strange to those in the budget office and Minister of Health. The Director of Hospital Services, Dr. Bimpe Adebi, said she was trained to most of the happenings there. While she was part of those that signed the memorandum of actions over 115 days ago. That shows you the insincerity of the government. And in time we come back to table, you give promises you cannot fulfill. Nigerians should hold the government responsible, because if it's over 115 days where we stopped our strike on the 10th of April, and now we are coming back again to embark on a total indefinite strike, means that some parts are not doing their own part.
So let's talk about that part, that government doesn't seem to be, it looks like government is not fulfilling its own part of this responsibility. And now we know that there's also an inclusion of removing house officers from the scheme of service, which the National Association of Resident Doctors is also now protesting. But you know, what we see most of the times is this emergency memorandum of action when National Association of Resident Doctors go on strike. There's, you know, something quickly put together to resolve it, whether it is followed or not. But is there anything being done on the long term just to ensure that, especially on the part of the NMA, just to ensure that we do not have any of these emergency memorandum of action, that government actually does its part in ensuring that resident doctors and just medical health workers are taken care of in the country?
Thank you for that question. The problem on ground now didn't span just yesterday. It has been going on for the past decade. The last time the hazard allowance was reviewed was in 1991. And up to in 2001 now, that means it has been left there to also have 5,000 naira as an allowance. It's not unusual when you hear people go having a brain drain when members are traveling to the United Kingdom, Saudi Arabia, and the rest, because they know we have one of the best practicing medicine in Nigeria. But when you cannot provide the basic things, you cannot go anywhere in Nigeria, any zone in the country, where you can see a government-owned MRI, CT scan, even good radiology systems, because they tend not to have the money to provide them. When the budget of the country is 4% of the entire budget, when clients like in Ghana and South Africa, when we talk of in Africa, they are doing far better with good outrate, lesser maternal and child mortality. That shows you where they lay their interest on. But when you have where you put 4% as a budget, where you know that nothing functions, you go to anywhere, nothing is happening there. You can't even basically cannot even get a plaster to use or a syringe to use when you're seeing the patient. Yeah, you are aware of the budget that is given to Aso Rock of billions of naira, and still here we have to travel abroad to get best treatments. We are aware that me and you cannot afford them, but those in political powers are able to go anywhere in the world, and we suffer. Those are questions we have asking Nigerians. Those are questions we're asking government. Where do our priority lie? Do our priority lie with having a good health sector, or wanting us to suffer and die first? Apart from the pandemic, you know that hunger is worse than any other disease.
When members are not I guess that's also the worry that people have now. The fact that this strike is also coming, you know, while we're having the third wave of the pandemic. Nigerians must be apprehensive at this time, and we hope that, you know, we find ways to resolve all of these issues. But that's the time we have. Thank you so much for talking to us, President, National Association of Resident Doctors, Dr. Uyilawa Okhuaihesuyi.
Thank you for having me.